Question 30. Which lab confirms myocardial infarction? A. Troponin, B. Hemoglobin, C. WBC, D. Potassium. Answer: A. Troponin is highly specific for MI.
Question 31. Which position reduces venous return? A. Supine, B. Trendelenburg, C. Sitting upright, D. Legs elevated. Answer: C. Upright position decreases venous return. Question 32. Which intervention prevents deep vein thrombosis? A. Fluid restriction, B. Early ambulation, C. Bed rest, D. Elevating head of bed. Answer: B. Ambulation promotes circulation. Question 33. Which sign indicates infection? A. Bradycardia, B. Hypothermia, C. Elevated WBC, D. Decreased BP. Answer: C. Leukocytosis suggests infection. Question 34. A client on steroids should be taught to A. Stop medication abruptly, B. Take on empty stomach, C. Taper dose gradually, D. Avoid fluids. Answer: C. Abrupt withdrawal causes adrenal crisis. Question 35. Which oxygen device delivers the highest concentration? A. Nasal cannula, B. Simple mask, C. Non-rebreather mask, D. Venturi mask. Answer: C. Non-rebreather provides highest FiO2. Question 36. Which sign suggests pulmonary embolism? A. Bradycardia, B. Sudden dyspnea, C. Productive cough, D. Hypertension. Answer: B. Sudden dyspnea is a hallmark of PE. Question 37. Which lab value indicates metabolic acidosis? A. pH 7.48, B. pH 7.30, C. HCO3 negative 26, D. PaCO2 40. Answer: B. pH below 7.35 indicates acidosis. Question 38. Which client should receive priority care? A. Client with nausea, B. Client with chest pain, C. Client with headache, D. Client with fatigue. Answer: B. Chest pain may indicate MI. Question 39. Which intervention prevents hypothermia post-op? A. Cold IV fluids, B. Warm blankets, C. Frequent baths, D. Lower room temperature. Answer: B. Warm blankets maintain body temperature.